Thanks, Sue, for that lovely introduction. And it's great to be here today to talk about our research project, which was a small project examining women's views on the visiting guidelines during the COVID-19 pandemic in the National Maternity Hospital. So firstly, I'd like to thank the organisers today for allowing me to speak to you all, and it's great to have this opportunity. And I'd like to really thank Jean Doherty and Mary Brosnan for their support in completing this project. So I think we're all very aware of what COVID-19 is, and it's hard to believe that it's almost a year now since it was declared a pandemic on the 11th of March 2020. Visiting throughout all hospitals in Ireland and indeed internationally was greatly restricted because of the pandemic. There was huge concerns for the safety of mothers, babies, partners, and of course staff. Social distancing was also an issue in almost all maternity hospitals across the country, and we did our best to use the facilities that we had, but it was difficult to maintain social distancing with limited space in the hospital. So the aim of this study was to gain an understanding of women's experiences of visiting restrictions imposed due to COVID-19 and to provide information to inform policy development in relation to visiting. So we developed a questionnaire and distributed it to women who were attending antenatal appointments, scan appointments, who were inpatients on the antenatal and postnatal wards. There was 13 questions on a 5-point Likert scale, ranging from strongly agree to strongly disagree. 7 of the questions were for all the women in the survey, with an extra 6 for women who had their baby. And these were questions asking about support with feeding and visiting after a baby was born. We also had 4 open-ended questions, and I listed them there. They were, what do you feel have been good about the visiting restrictions? What do you feel has been difficult? If you required care and isolation at any stage, how was your experience? And any other comments or suggestions. We also asked some demographic questions just to get a feel for their age and their parity. So 422 surveys were completed during a 2-week period in June of last year. We used descriptive statistical analysis using SPSS to analyse the quantitative data. There was a qualitative data provided by the free text comments from 306 of the women, and we analysed this using thematic network analysis. The report was completed by the end of June, and changes to the visiting guidelines as a result of this was implemented by the end of June of last year. I'll now discuss the results under the 6 main themes, which were identified when we analysed the data. Firstly, the benefits of the restrictions, then safety and communication, the importance of birthing partner support, becoming a mother, new mothers needing time and space, and support from hospital staff. So the first theme was the benefits of the restrictions. And as you can see, the vast majority of women in the study felt that overall the restrictions were a good thing, with only just about 7% of the women disagreeing that the restrictions were a good thing. Overcrowding or lack thereof was a significant theme within the free text comments. Many women praised the restrictions for reducing footfall within the hospital. Another key theme captured in the free text data was the advantage of COVID-19 restrictions in streamlining appointments and reducing waiting times. And you can see some of the quotes there from the women in the survey. It hasn't been crowded, which gives a bit of peace of mind during the consultations and time at the waiting room. Appointments were very quick, nearly no waiting time. It's not crowded. Safer environment, feel as less people and children in the clinics when waiting. Staff were super helpful and even more understanding than normal. Under safety and communication then, on this slide you can see that the vast majority of women felt that the hospital had made adequate preparations for them to feel safe, and that the hospital communicated very well about their visiting restrictions. 90% of the women surveyed felt the hospital had communicated well with them about the visiting restrictions. Safety of mothers, babies and staff was a key theme in the free text comments. A large number of women cited this as the main benefit to the restrictions. And you can see some of the quotes that women wrote on the surveys. The good outweigh the difficulties. I feel safer with the restrictions in place. I have felt the hospital has kept women very safe during this time. You don't have any worry about your unborn baby's health. While it's difficult not to have your partner there for antenatal visits and on wards, I 100% understand the decision being made and feel safer because of it. Understanding that we need to be careful to keep everyone safe and a feeling of security. Many women commented on the high quality of information around the hospital. The hospital website in particular was cited as being a significant resource for women attending the hospital. Some women did request that communication could be improved and requested text messages or letters be sent out to them with updated information. And some of the quotes from women include these. I like that the reception area at the entrance controls who comes in and provides information. I completed the online webinar antenatal class last week, which was fantastic, and classes are not taking place in the hospital. I have seen new information appearing on the website. It would be helpful to receive emails to let us know about new videos, etc. have been added. Signs and information is clear to follow. Birthing partner support was another important theme in the data. And you can see that a lot of the women, 86%, would like their partner with them for antenatal visits. And 60% of the women did miss their partner with them on the antenatal ward. 60% of the women feel their partner should be able to attend with them for ultrasound appointments or scanning appointments. 262 women responded to the question regarding the negative consequences of the visiting guidelines. The vast majority of these cited not having their partner as the main negative consequence of this. And some of the quotes from women are really important. My partner and I have been through a long process to have this baby. Not having him here at all has been awful for both of us. It has made the pregnancy very lonely. I feel overwhelmed, being the only one being told information. I think dads should be allowed to come to the scanning appointments and unlimited visits when the baby comes. For me personally, not having my partner with me when told baby had heart issues. When I attended for my scan, I was anxious because early scan discovered chromosomal abnormality and I was having a follow-up scan. I was very anxious about receiving bad news all by myself. Maybe consider allowing partners at appointments such as the 20-week scan or appointment where decisions, reinduction, etc. are being made. Over 90% of the women in this study would like to have their partner to be able to visit them after the birth of their baby. And this was really important to the women. We could see this from the answers to this question and also in the free text comments. There were, of course, some benefits to the restrictions, and several positive consequences of the restrictions emerged from the data, besides the obvious safety factor. Becoming a mother was a key theme within the free text comments, and also you can see on this slide that the majority of women enjoyed having extra time alone with their baby, and only 5% of the women surveys didn't enjoy this alone time. Almost 95% of the women in this survey reported receiving adequate support after their baby was born. The restrictions allowed for less traffic on the wards, and women valued the time they had to become independent with baby care and receive help from the midwives. And you can see this in the comments the women made. So learning to become independent with baby and take advice from midwives. As much as I felt sad on Friday night after delivery that my partner could not return, I'm now glad of the days of my time to adjust to motherhood. I learned so much from the nurses and got my time to sort myself out and learn how to look after baby without external pressures. Totally benefited me. The one-to-one time has been nice for bonding. The midwives and other staff have been really helpful and supportive. More bonding time with baby and easier and more comfortable feeding knowing there are no visitors. It is a lot quieter, more time to adjust and try to get the hang of breastfeeding without an audience. We also found the need for mothers to have time and space. 2/3 of the women in this study believe that children should not be allowed to visit the hospital, and less than a quarter of the women surveyed would want their other children to be able to visit their baby after baby is born. And just 20% of the women would want other family members to be able to visit them after their baby is born. Several women valued the opportunity to get more rest as a result of less visitors on the postnatal wards. They were able to move around the wards more freely without fear of bumping into someone else's family member. So the women said things like this: quiet time, spend time with the baby, sense of safety with essential people only around, great sense of privacy. Every other woman pretty much in the same bout. Women can walk around freely without fear of someone staring at them if they were walking funny or carrying maternity pads, catheters, etc. Less noise, great time for mummy and baby. Have enjoyed the quiet time and don't feel undue pressure to have visitors. Third baby and family can assume it's okay to visit and it's hard to say no. I have peace and quiet with my child. I felt no pressure to have family in. There were several comments made in the survey from women about staff and thanking staff for the care that they received. Women talked about great, excellent, and amazing care that they received during the pandemic. And some of the quotes from women here: excellent, staff were most helpful, understanding, and had plenty of time to assist. The ward was not too busy as there were less people and visitors within. Really excellent. The doctors, midwives were all caring and empathetic. They really helped put my mind at ease and looked after me really well. Everyone was very kind. Amazing experience from our first scan to walking out the door today. The team of amazing people who have been lovely, supportive, kind, and up for a laugh and fun have been wonderful. Harrison got so many extra cuddles from all these people. We got a lot of lovely comments from women, and some even named staff that they felt were really supportive to them. Women in general did agree with the restrictions, and even women who missed having their partner with them stated that they understood the rationale for the guidelines regarding visiting. Most common request from women was to allow their partners to attend the postnatal ward for short periods after the baby was born, especially if a woman had a caesarean birth or suffered from mental health issues such as anxiety. And this is something that we really took into consideration when we were changing the guidelines last year. And I'll talk more about that in the next slide. So here are some quotes from women around easing the restrictions. Not seeing my husband, very little time spent with him post-birth, as had to go to theatre after, but all understandably so. Being alone and my baby in ICU, but I'd rather my baby be safe than open to the virus. Tough not getting a break by day to rest, shower, eat, or go to the toilet, etc. Miss sharing the first precious days with husband and family. Not having husband to help during the day and having a busy night with a newborn was very difficult, as sleep deprivation while minding a newborn, I feel, is dangerous. So the recommendations then from this study was to adopt a phased approach to the reintroduction of visiting in line with government guidelines. Given the vital role of the woman's partner, they will be prioritised and permitted to visit before any other visitors. Face coverings will be strongly encouraged for any visitors. And the hospital has worked to improve communication about visiting, and the website is continuously updated. So since this study was completed in June of last year, we have changed our guidelines. Partners are now able to attend the 20-week scan. And based on the results of the study, we could really see how important it was to women to have their partner with them after the baby was born. So partners are welcome to visit on the postnatal ward for a few hours a day. We made a decision not to change the guidelines in the second or third wave of the pandemic and kept those guidelines in place, and that partners could attend for the 20-week scan and can still attend in the postnatal ward as well. So it has been a difficult balance to make sure that we are meeting the needs of women, but also balancing any potential infection prevention issues during this pandemic. So as I say, we haven't changed our guidelines in the second or third wave, and we have constantly updated our website. The visiting guidelines are under constant review and are reviewed by the EMT on a weekly basis based on the government guidelines and the situation within the hospital. So again, thank you very much for the opportunity to talk today, and thank you to the research team for their help in this project.
Fabulous. Thank you, Sarah. That's very, I mean, it's funny. It seems a long time ago in a way, doesn't it? Yeah. And yet not. And you kind of wonder, I mean, I'm assuming that when you talk about visiting, it's primarily the partners rather than lots of people coming through to keep it as safe as possible. And I wonder because it's interesting, the becoming a mother theme of mums feeling that it was quiet time, it was private time, and it was very positive. And I think that actually it's interesting that this research supports what midwives were reporting. You know, when we had a few of the maternity and midwifery hours where the same things were being experienced, and breastfeeding rates increased, and women were saying how they felt more comfortable and they were able to talk to other mums rather than, you know, where they close all the curtains and just keep themselves themselves. It'd be interesting to see if you did this research over the coming, you did a repeat. I don't know, are there any plans to add to this research?
Yeah, we would hope to possibly repeat the study or to develop it a little bit further. Yeah. There's so much that you could look at, as you say, breastfeeding rates, and just even exactly as you say, staff love the fact that they're not all hidden behind a curtain now, that there's a little bit more interaction with women. And I think that support for new mothers is really important, particularly now because there's not as much in the community when they go home.
No,
you know, there's not as much opportunity to meet other mums and that. So that's important. So definitely something we will look at this year.
Because I think it must have been very positive for the midwives to get that, because that's incredibly positive. Unless you filtered out any negative comments that were made. And I wouldn't have thought you would have done. That sounds very positive about how women were feeling the support they were getting from midwives and from doctors and other people in maternity care.
Yeah,
that's incredibly positive.
We were surprised, I suppose, exactly how positive the results were. Like, the women were very, very understanding. Of course, as I said in the presentation, women did miss having their partner, and they really did miss having him there for the big milestones like the 20-week scan and things like that. But we did our best to listen to what the women wanted and to change our guidelines. But I suppose we were, happy to see that positive feedback and to realise that the women actually didn't miss having all their relatives coming in after the baby was born, and actually they valued that quiet time and privacy afterwards.
Yeah, I mean, maybe that's one of the things we'll learn in the future. Maybe we need to keep it more of a family, very close family. Whoever that woman deems is close family, of course, because some women would want lots of people, but for others, they might just want less. Got some questions coming through. Okay. So, Sarah, no escape. We have Ali Broderick. Hi, Ali. We have found some similar themes re postnatal visiting, and mums find it useful for time alone. But need enough staff to make sure women have enough support. Can I ask what your ratios are like of midwives to women on postnatal ward?
I'm sorry, I don't actually know that off the top of my head. I suppose I can see from the results in the survey that women did feel very, very supported by staff. But I don't know the exact
The
ratios, I'm
exact
afraid,
ratio.
sorry.
Okay. Okay. We might find that out later point.
Yeah.
Later point. Okay. Thank you. And Sheila O'Sullivan says perhaps we should keep restricted visiting postnatally. Benefits seem to outweigh downsides, it seems.
Mm.
But having said that, of course, that time you have to kind of put yourself back to that time when everyone was a bit scared
Mm.
and maybe women felt safe because the restricting visitors. I don't know if your study team picked that up or made a note of that. I don't know.
I suppose you're right. It would be, as you said earlier, it would be worth repeating that now to see, because there was a lot of fear, particularly in the early stage of the pandemic. And
Surely.
this study was done in June, which was kind of around the time that restrictions in general were starting to ease a little bit coming into the
Yeah.
summer. And so it wasn't during March or April last year when everyone was really, really scared. But
Yeah.
it would be worth repeating it now to see what women think. But I suppose from looking at our data, it does seem that once the women have their partner, that seemed to be the most important thing for them.
And that would make sense. Okay, that's lovely. And then Nicola Clark makes a comment to say, thanks, Sarah, great work done. Just shows the power of communication and how midwives put priority for mothers and babies. Well, that's very true. And that's obviously, I was feeling it was really positive for the midwives, because I think one of the difficulties about the COVID pandemic has been that it's a lot of stress on hospital and community staff, health staff. And one of the things last year I was feeling that people were getting a lot of gratitude and thanks at that time. And I'm not sure it's quite happening now. Are you getting a feel of that, Sarah?
Yeah, I suppose. I mean, it's kind of getting to it's over a year now, so people, I think it's hard to keep going, I suppose.
Yeah.
But I mean, I do think in general there is a lot of gratitude there. Like we do see that with the families we meet. I think people are very appreciative, even more so now than normal. But maybe just not so much as much in the media, I think. But
Oh, that's true. That's true. Yeah.
the women that you're meeting, I think on a day-to-day basis, the families we meet are very grateful. But yeah.
Yes. That's a lovely way of putting it. Thank you, Sarah. And that's been really fantastic. I've got, hang on, I've got a question. You may or may not know the answer to this one. Shelley O'Halloran says, how come the UK have rolled back restrictions for partners in line with the WHO recommendations, but not here in Ireland?
I suppose I can only speak for the hospital.
Yeah, that's fine.
You know, we have I don't know if roll back is the right word, but we have increased the amount of time that partners are able to visit in line with the HSE guidelines, and as say it is under constant review.
Yeah, and of course within the UK we've still got our lockdown in effect. So we're meant to be restricting moving about anyway. So that's possibly an answer for Shelley. Thank you for the question, Shelley.
Yeah.
And thank you so much, Sarah, for sharing the research. That's really so interesting and really positive.
Yeah.
Because though COVID has been very negative and is still negative and proving very stressful and painful for a lot of people, there are some elements that we can take out and feel positive, and especially within midwifery, feel positive that we're at least doing our best for the mums and babies and families, which is great. So thank you so much, Sarah, for coming.
Thank you very much.
Thanks
for having me.